Thank you very much. I suppose I just want to have a few specific questions. First off, I suppose it's a proposal that I would put forward and ask as a senator here, and also as a parent, that if I was bringing my child to a service, that there will be full transparency on what I was to expect, on what can I do, what is the best avenues for me to advocate for my child. So like just the CHO 8 where I am, right, Erin, your son needs X, right, there's X amount of children on the waiting list, you're there, you are on that waiting list. Just tell us where we are. We know there is waiting list, but just tell us what's the story. Be fully transparent, because I feel parents are going through in the dark. I learned last week that a parent can self-refer to a disability service. I didn't know that. I didn't know we could self-refer to a primary care service. So this education and knowledge is power. So I would really, ask if there was, a pamphlet, information, billboard campaign to be able to educate our parents and show our children, educate them and show them, well, this is the situation. What am I going to expect? What are the therapies? What does this multidisciplinary team mean? What will it mean to you in a general sense? Obviously, we want the individualized plans. What does that mean? What does all these acronyms mean? Because it's all nonsense in a way when I want just my baby to be cared for. So I suppose that would be a proposal that I would ask the HSE to deliver, and show that over all the CHOs, to have that transparency across. So me as a parent, that I can say, this is what's happening, and me also as a senator and representative, this is what's happening. I also want to ask, what will happen to children who have already been through an SOP? Will they have to be redone? Regarding the recruitment, has there been a policy shift recently within the HSE on the recruitment of senior positions in disability services? Because I've heard anecdotally that there has been, because there's an awful lot of lower level positions, that people had no career progression, or didn't see a career progression within the disability service, so moved on to places like primary care. And I know Minister Rabbitte has been speaking and pushing for this recently. And I also want to ask a specific question, carrying on from the recruitment as well. Has the HSE gone abroad to recruit for disability services, specifically for disability services? And is there any, a model of, incentivization for bringing home our highly trained staff, and getting our highly trained staff into the public sector and away from private sector? Because someone who used to have her own business, I know running your own business isn't all what it's cracked up to be, and a safe, secure job in a public service is very appealing to someone who struggled running her own business. So there's a whole pile of incentives. How can we incentivize people to come in? Because it's chicken and egg. People don't want to come in because it's under-resourced. People are coming in, and so how do we make it a really positive place to work, and then a positive place for children to be?
Chair, can I just take the last point from the Senator first, and then just ask my colleagues to somebody. Look, Senator, I fully agree with you. The challenge for us in terms of international recruitment, or indeed recruitment generally, is, and look, I've worked for 30 years in the private sector, so I know the flexibility you can have outside of the public service, but we are governed by public service policy, and there are certain ways in terms of we can help people come home from abroad with relocation within certain limits for people that we would utilise, but it is a difficult and challenging one. I would just make a general point in terms of incentivisation or recruitment. The HSE is a good place to work. The health service is a great place to work. It might not always perceive that when all of our public commentary about it. So certainly I would say to everybody, in terms of helping us, sometimes, and this goes for all of our stakeholders, including ourselves, sometimes we need to present a very positive experience of what people do experience when they work in the HSE. It doesn't always get out there, and you know, people are reluctant. To be frank, people are very reluctant to come into public service jobs now, and particularly at senior level as we're trying to recruit. I can just say that to you. So there is a big challenge for all of us to make the public service attractive, to ensure that we're getting the right people. But certainly, I know many people would not come into the public service for many different reasons. But you are right; it's a great place to work. There are good conditions, there's good pay, and there's good, you know, pension entitlements people have, and that's what we're trying to leverage. And I would just make that as a don't take it as any criticism of any of us, including myself. It's just a general. I think we can create a better expectation or perception of what it is to work in the health system, and it is really good. Bernard, do you want to just sum them out?
Thanks, Paul. Just in follow-up to a couple of your other questions, in relation to the transparency with families and the wider community, and also an education programme, that is, and I don't want to just keep repeating myself, but the work that we're doing at the moment in terms of our communication strategy, a lot of what you're talking about is factored in there. I think the overall principle of being absolutely transparent with people is something that we are committed to. It is a direction we want to go. I think it's very difficult for staff sometimes to sit in front of families. You know, it's okay for me to be sitting on a call like this and to say, you know, we will be transparent in terms of making information available. I know it's very difficult at the individual level for an individual staff member to be sitting with a family and to translate that principle into a conversation with people, you know, because you may be conveying a message that is very difficult for a family to hear. So I don't want to be trite or flippant about it, but it is certainly something that we'd be working towards, and look to do it in a way that we're supporting the staff who are the people at the front line of it. In terms of those who have previously had a PTA under the SOP, we are working on developing a plan for how we will engage with those families, and we will write to them and contact them directly once we have a clear kind of direction in the way that we want to go with it. And just the last point, just around the career progression, we have indicated that we would look at increasing the number of senior posts to try and create, I suppose, two things. One, some career progression to make it attractive to come into, but also as part of the strategy in terms of staff retention as well. So that is something that we're talking with the CHOs about.
And can I just ask there that maybe we decipher the PTA from an SOP, just for anyone listening in?
Okay, so the preliminary team assessment is the assessment that we were delivering under the standard operating procedure for assessment of need. And in 2021, of those preliminary team assessments that were completed, 54% of those children were identified as requiring further assessment. So obviously those 54% will be our priority in terms of doing reassessment. It's likely that the other 46% don't need further assessment, but we will also engage with those families to make sure. And I think the piece that Senator McGreehan said earlier, we discussed it when you had your visit last week, it is really, really important that parents realise they do not have to go through an assessment of need to access services. It is not the gateway to services. With the assessment of need process, there is, at the very least, there is a 3-month desktop assessment going on before any referral is made. A parent can pick up the phone themselves and arrange a direct referral to any team. So I think that's really an important message that we get out there to families. Assessment of need is not an absolute requirement. It's an option. Parents may choose to avail of it, but they do not have to go through the assessment of need route to access any of our health services. Okay?
Thank you.